Good afternoon. So good to see you all. Thank you to Dr. Nimrod for this wonderful invitation. I'm so honored to be here. Someone asked me, where do I come from? I'm a New Yorker, transplanted in Curacao, and now I'm in Trinidad. It is awesome to be here because we have so many great things to discuss with you. And I want to talk about the total wound care solution system. And my colleague, Dr. Manuel, will speak about his part of that system in a few minutes. We have a unique opportunity to change the tide of wounds in this country. We know the prevalence of diabetes. We know the morbidity and mortality of patients who have a limb amputation. And I want to give kudos to nurse Yvonne Braffett of Rovan Medical Clinic, who had managed 25 cases using the total wound care solution system. Out of the 25, I want to talk about 4 cases today and present to you evidence-based medicine. So the first case is a female patient. Diagnosis is peripheral artery disease, gangrene of the 4th and 5th toe. She had the implementation of the management, which included collagen particles, which I call the secret sauce. And I'll talk about the secret sauce after the 4 cases. And used wonderful secondary dressings. So what happened here was she had the opportunity to put collagen in the wound, to cover it, to have it cultivated and mature. And what happened was beautiful granulation tissue developed. In 11 days, the wound was 60% improved, which is phenomenal. Restoration of the patient's quality of life, which that's all in medicine that we want to achieve. Case number 2 is a 56-year-old male, edema for 10 years, infected, slough, a lot of problems in the wound, bioburden. Diagnosis was venous stasis. So what happened here? It was debrided. It was cleaned with wound wash. And the wound wash that I really have an affinity for is hypochlorous solution. It reduces the bioburden by 99%, which is phenomenal. You want to prepare the wound bed, and once it's prepared and becomes the recipient wound bed, you put collagen in the wound. Collagen, the most amazing fibroblastic proliferator. It's amazing stuff. Again, the secret sauce. So after it was washed and the collagen was put in, the patient started to granulate. This case, in 4 months, 80% improvement. 80% improvement, which is phenomenal and staggering. Case 3, we had a 90-year-old male, diabetic, for over 30 years, chronic diabetic ulcer, and we had debridement, offloading, again, collagen powder, and the dressing was changed every 4 days. The net effect here was in 19 days, we had 50% improvement. Amazing, phenomenal. That's what we want to see. That's what we want to achieve, employing all of the products in the total wound care solution system. In case 4, we had an 89-year-old female, venous stasis, ulcer, edema infected. Again, we assume all wounds are infected. It was debrided. Wound wash was used, hypochlorous solution. And collagen, again, was employed. This patient, amazingly, in 35 days, 25% improvement. Now, in the context of wounds that have comorbidities, don't be discouraged. Don't be discouraged, because you can employ these products in this solution system to turn the corner, to change the tide, to make the difference in your practice. And I want to just go over the highlights of the evidence-based results. Why is this wound system so efficacious? Because there is a wonderful thing I teach my medical students, as I'm the dean of the medical school in Curacao, is that 1 + 1 is 3. Synergism. That's what we want to achieve. That's the power of the portfolio. Using what we have and trying to turn the corner is an awesome experience. It's awesome to see the smile on the patient's face and say, "Thank you, doctor, you have really changed my life." This is the time to do it. Well, again, we mentioned hypochlorous solution, but again, the secret sauce, my favorite molecule is collagen. Why is collagen so effective? For the following reason. If the dermis contains 90% type 1 collagen and there's a void, why not replace what was lost? That's collagen. It's an excellent migrator, proliferator, ECM, establishment and production. Growth factors come in there, cytokines and interleukins, they talk and they get the job done, and it's the encouragement of angiogenesis. Using the secondary dressings like silver and alginate and fibrogel is part of this system. So I invite you, my wonderful wound warriors, or those who want to be wound warriors with us, join us in this amazing endeavor, and you will see amazing things happen. I thank you. Dr. Mann.